Hi, everyone, and thank you for joining us today. We're thrilled to have you all here for the first CTRC webinar of 2023. We've made it, yippee, excited to be here. Today, we are going to be talking about school health services provided via telehealth and where we are now. Next slide, please. If you are new to the CTRC, we want to introduce ourselves. We are the California Telehealth Resource Center. We are your source for unbiased, no-cost telehealth resources and support services. We are a part of the Ochin family of companies, and we are based in California, but we are your telehealth experts all around. So please know we're here to support you in telehealth. If you have any questions, us three with the California backgrounds are your CTRC team, and we're happy to be here. Thank you for joining us. Next slide. Today we have some wonderful guest speakers, so we want to let you know that, as always with our office hours and webinars, everything is for informational purposes. We're not trying to sell you or provide legal advice. We have no financial arrangement. We're just here to provide information and education. Yeah, and that is all. And today's session will be recorded and available later this week. Today, I'm proud to introduce some presenters from the California School-Based Health Alliance. We have Sergio, Amy, and Sang joining us today to discuss telehealth in schools. So I'm going to hand it over to our wonderful presenters to take it over. Thank you.
Hi, everyone. Good afternoon. My name is Sergio Morales. I'm the Executive Director with the California School-Based Health Alliance. And myself and my colleagues, Sang and Amy, are just here to share a little bit what we've learned, right, over the years. And right now, this emerging excitement and innovative need around telehealth, right? And so we want to share with you some big picture lessons learned, some recommendations, and we'll continue, taking turns today, kind of presenting on that information. But first and foremost, what I really want to do is introduce you to the California School-Based Health Alliance. For those of you who may not be familiar of our work and what we do, we are the statewide organization that's dedicated to improving the health and academic success of children and youth by advancing healthcare in schools, right? And what we do, is, really just putting healthcare where kids are, in schools. That's our focus. So whether that is traditional brick and mortar school-based health centers, school health resources, wellness centers, all of those elements are what CSHA focuses on. Next slide, please. It would be remiss of me if I did not talk about our exciting work and what we're able to offer for the field. And I strongly encourage you to take a look at our website if you're not familiar with it already, and then also explore the membership benefits. We have various levels of membership for individual members, organizational members, that really provide additional benefits, such as registration on our discount registration on our conference, tools and resources, a newsletter where you can get updated information around what's happening in the field of school health in California and beyond. So strongly recommend you to join as a member, sign up for our newsletter. We have all kinds of resources and information on our website that is in our chat, schoolhealthcenters.org. Next slide. What we plan on achieving today in our conversation is, our aim is by the end of the conversation today, you'll be able to describe at least 3 benefits of school-based telehealth services, listing 2 elements that are needed for telehealth services in schools, and then articulate at least 2 questions for educators to explore with telehealth companies. Next slide. So, in California, what we know of is that we have about 300 school-based health centers in California. Now, mind you, we do a census where we collect data and query the field. Those that are established school-based health centers ask folks to spread the word. And right before COVID happened, and that shifted some of our data, right? So just want to recognize that the last time we collected really clean, good data was before COVID. And we know that there are, since COVID, there has been many that have had to shift their priorities or focus, have contracted and also some school-based health centers that have had to stop offering services. But we also know that there's many wellness services focused on mental health services throughout California that we're still getting a handle on and including them on our number count. So just wanted to kind of highlight that and let you know a little bit about the number of school-based health centers in California. And in addition to that, one thing I would like to provide an update on is our Student Health Index, which is a fascinating tool which interlayers, has overlays of ADA rates, public health data, looking at where the most common need, where the most common areas in California are where there's a high need for school health resources. So feel free to look at that as well. In looking at school-based health centers, what services are provided, just really want to highlight kind of the most services that are being offered are some kind of medical mental health services. Those are our two most popular that we're seeing in school-based health centers in California. Many also provide dental prevention, reproductive health, youth engagement, and some also offering dental treatment. So just wanted to paint a broad strokes picture of what our current school-based health center networks in California, what services are offered and provided in them. Next slide. And then, thinking about CSHA as a, umbrella organization, as a convener of various stakeholders throughout the state of California, but really looking at the model of school health centers. What it currently looks like is we have those that are school-based on school campuses, those that are school-linked, that may be, near a school-based campus or school campus where one school or multiple schools see that as the hub of where to go to access services. Mobile vans are definitely a part of that umbrella as well. Those public health departments or federally qualified health centers that form a partnership with a school or schools to bring their mobile vans to campuses and offer services on campus, right? And then of course, telehealth, which is what we're here to discuss today. Looking at the various telehealth modalities that are school-based health centers and school health centers generally may connect with a provider or series of providers to offer health services to students on school sites. So with that, I'm going to turn it over to my colleague, Amy.
Thanks so much. So yes, as discussed, we will be diving deeper into how telehealth looks in schools and school-based health centers in California specifically, but just to get a little more grounded in the definition as defined by our national agency, the School-Based Health Alliance, that telehealth exclusive is when patients access primary care specifically, so that's the nuance of their definition, when they're only getting their primary care through telehealth, but other services at the school-based health center might be provided in person. And we're going to go deeper into an example of this later in the presentation around a site where they're getting behavioral health and health education and other services in person, but the primary care and the medical services are coming through telehealth. This is not the only way that a telehealth structure is happening in schools and school-based health centers. We're going to talk about some other models. I think most actually are some kind of hybrid, especially in this sort of post-COVID world that we're in. A lot of school-based health centers went to telehealth, and now they're sort of coming back into a resting place of which services work best as telehealth versus which ones work best in person and how they best fit together. So that's how we're going to be spending our time today. Next slide, please. You can see a dramatic increase in how many school-based health centers provide some kind of services. This is not all, some kind of services via telehealth over the last, that's just 7 years. And of course, COVID was the biggest piece of this between 2017 and 2020. This is national data, but we saw these same themes in California, that pretty much every school-based health center in California, if it didn't have to shut down, it pivoted to telehealth during COVID. And many, if not most, have kept some kind of telehealth services, even now that they are fully reopened in person. Next slide, please. So I know I'm preaching to the choir here. I know you all believe in telehealth as a way to increase access, but just specifically when we're thinking about the student population, I think the two main pieces here is that it's really about reaching youth that wouldn't be reached otherwise. And even our most sort of die-hard fans of in-person services in school-based health centers will tell us that indeed the students that are not as linked to school, maybe students who are suspended or expelled or caught up in the juvenile justice system, or just truant and not coming to school, having chronic absenteeism, those students can be reached through telehealth services in a way that that they wouldn't get services otherwise, because they're not necessarily coming into the clinic, into school. And then, of course, linking to services that otherwise wouldn't be received. So even if a student is coming into campus, getting their primary care or their behavioral health from the on-campus in-person provider, that maybe the dermatological services wouldn't be received, or the psychiatric services. So getting those extra services that if we didn't have telehealth, then they wouldn't have it all. Next slide. I'm sure you're all familiar with these concepts, but just thinking specifically for schools, you have to think about making sure we have the correct equipment, the right personnel, and then really the right systems. And we're going to dive into the nuances of these in a minute, but this is part of what we talk about when schools are looking at what does it mean to have telehealth services. And then the last point I want to make is that I think oftentimes people think of schools and school health centers as the sort of recipient of telehealth, but they can also be the provider hub. We have some examples of school-based health centers that are looking to be the hub of in-person services with which the feeder schools are coming in as the spokes to receive the services. So it's a great way to sort of take an existing structure of in-person services and then expand the reach in the community to other smaller schools that couldn't necessarily sustain in-person services. We generally, and this is like a very broad generalization, but like to say that we can help a school as long as it has a relatively high Medicaid population and a decent number of students, 1,000-ish, that we can get a fully functional, fully sustainable in-person school health center up and running. But if you have a much smaller school, then that's going to be a lot harder. And so this is a great way to think of having a sustainable in-person school-based health center in one school, and then feeder schools that need services through telehealth. And with that, I will pass it to my colleague, Sang.
Yeah, thanks, Amy, and thanks, Sergio, for really getting us started. Can we go back to like 2 slides prior? I just want to mention something really quick. Oh yeah, that one. Amy had mentioned this about, sort of what are the basic elements needed for telehealth services, and you can see there, under equipment and personnel. I have to say, I think the systems one is really important, and this is something that we talk about just in general when we think about school-based healthcare, and really what makes it a system where we bridge, educators and the healthcare, personnel, and where they intersect. And what we have found that, and it's not as many sites as we'd like to see for now, but what we really are learning from the sites that we do know of is really just that system for communication, and for really, how does this work out? It's one thing to have the equipment and the people, but then how do they interact with each other, and how do they interact with students, and how do we really bring students in so that way they can get the care with the technology that's available? And it's like I mentioned, it's even more important when we think about telehealth than even just, school-based healthcare, like the brick and mortar in person, you know what I mean? Because this just involves another layer of complexity. So I just want to mention that it's really that systems angle that we want to like dig into and learn more about. Go ahead and go back to that, but thanks, Amy. So we are learning about what telehealth looks like in practice, but I wanted to just ground us a little bit more by sharing what do we know in the peer review literature, right? Because that is, where people can take the time to evaluate and also really scan the field, from a more formative angle. And so we found more than half a dozen, maybe 8 or 10 different articles that have appeared in the peer review literature in probably in the last 6 to 8 years. And I just want to share a couple, or I guess 3, just to kind of give us a sense of what that's looking like at the national level. That first one, you see an innovative approach to care. Excuse me, that came out a couple years ago, and that's actually a study that was done looking at telehealth services based in West Virginia. And they found that when they looked at being able to really think about putting telehealth services in that part of the country, which you all know has lots of rural and mountainous regions, they found that it really actually increased access to specialized care for the most vulnerable youth, particularly around mental behavioral health care. And that it really, that study really added to the growing evidence that these interventions, through telehealth is just as effective as in-person consultation or evaluation or treatment. And so it's nice to see that, bringing healthcare to schools, regardless of modality, is something that is so needed, but also it works. And that's what we want to know about. The middle article there, the use of telehealth-based health centers, school-based health centers, that's actually by our colleagues at the national office. They use a lot of the census data, which I think Amy mentioned, or actually Sergio mentioned, for all of the 2,700 plus school-based health centers in the country. The national office, they conduct what we call a triennial census, which is a survey every 3 years, just looking at what does your school-based health center look like in terms of the landscape, in terms of operations, finances, policies. And they take this data to really paint that picture. And part of that picture includes a small snapshot of telehealth. And so our colleagues were able to really, put that together, and they found that what the definition that Amy shared earlier, telehealth exclusive, there are actually 4 states and in the United States that are really leading the way. Unfortunately, California is not one of them, but that's okay. We can still lift others, The 4 states are Georgia, North Carolina, Texas, and South Carolina. And I would imagine a lot of that has to do, again, with, rural areas, mountainous areas, but also just how, for a place like Texas, how expansive it is. And so it's really nice to see different parts of the country really leading this movement, and California has a lot to learn, but we also have, our share of school-based health centers, and really a lot of people interested in bringing telehealth services to that. And then the last article at the bottom there, that's a really recent article that came out looking at the potential utility of school-based telehealth, in the era of COVID, which, that's just going to continue on. And it was basically a study that was done looking at it was a retrospective analysis looking at the largest network of telehealth programs in the Dallas-Fort Worth area in Texas. And they pulled out, encounter records and really looked at, what kinds of services were being delivered and what were, across, that area. And they found that asthma and other respiratory disease was a primary diagnosis, 28%. I thought about that and I thought, wow, in our school-based healthcare, we talk a lot about the need to really help students manage chronic conditions like asthma. I mean, school-based health center is set to be able to respond to that kind of management. I worked in Los Angeles for more than 10 years, working with wellness centers in LA Unified School District, the second largest school district in the nation. And our data was telling us that about 1 in 7 students actually suffered from asthma. And so if you think about that, wow, this has so much potential, right? Schools have so much potential to really help students manage their chronic conditions, so that way they can, they won't have to miss school, and they could, be back in the classroom and they're received to learn. And this is just, an example of like a core benefit of having, some type of health services at schools, including through telehealth. The second most common diagnosis was actually injury and trauma, which I thought was interesting. So about 18%. So, nearly half of what they were providing through telehealth in that Dallas-Fort Worth area were around asthma, respiratory diseases, and injury. So just to kind of give you a sense of, what that is. I think what we're seeing here in California is a lot of behavioral mental health, particularly during COVID. And so again, huge potential for how this can really play out in our schools. Okay, well, I won't continue to bore you anymore with the literature, but we can move on to the next slide. This is exciting. We found this out, but we couldn't get any more information about this, but HealthNet announced that they were going to fund school-based telehealth services at 200 schools in 10 California counties. So this came out last year, and and I think we're still trying to figure out where these schools are and sort of how this is rolling out. But they basically announced a $3 million grant to sponsor Hazel Health, which I think some of you who are on this webinar probably know they're one of the big players in terms of a telehealth company working with schools. And we're going to talk a little bit more about them because we have an example of how that's working out. But it's health plans are in this field and want to figure out how to do this as well. You know, and 200 schools is quite a number given, you know, we have about 10,000 schools in California. The 10 counties, I did find out what those 10 counties were. And so I'll just read them to you out quickly in case any of you are from there and we can sort of think about what, you know, what that may look like. It's Butte, Imperial, Kern, Los Angeles, Riverside, Sacramento, San Bernardino, San Diego, Stanislaus, and Tulare. And so, you know, when I was looking at that list, I thought that's so interesting because we are the State Alliance, we have presence in about maybe more than half of these counties, particularly where I am right now in the Inland Empire with San Bernardino and Riverside County. And so it's really exciting to see, you know, that, you know, financial support is really going to these areas that we have long known, you know, the need is great. And also, you know, they're less, I mean, a few of them are urban areas, but a few of them are also just more remote areas that I think telehealth could really make sense. And like I mentioned, just the opportunity is there. If any of you who are on this call know more about this, please reach out to us and share because we love to learn about what this looks like. Okay, go ahead, next slide, please. Okay, there's one more sort of article I wanted to just mention to help us, you know, ground us in all this, and that is that there was actually a policy statement that, you know, around looking at telehealth as part of that. And so the American Academy of Pediatrics, about, I want to say maybe a little more than 10 years ago, actually came out with a position statement looking at how school-based health centers can really be part of the pediatric care service delivery. And so we were very excited in our school-based healthcare world to really be recognized by the AAP, but also that, you know, to just really say, hey, you know, this is, you know, there's literature on this, there's evidence around this as being one of the effective modalities of delivering care to students. To students. But we were more, you know, even more pleased when in 2021, which is when they released a statement where they actually specifically looked at school-based health centers and pediatric practice, that there was a section that included telehealth technology services. And if you go on to the next slide, I just want to point out a couple of things from that statement, which, you know, if you're writing grant proposals or trying to make a pitch, you know, to school administrators or perhaps even to your clinic administrators about telehealth, you know, bringing some of this in, I think will help make the case, just because we know it's a highly respected, you know, organization. And when they put out these policy statements, it just helps, you know, solidify that concept. But basically, the, you know, key point in there was the increased use of telehealth technology services remains a great opportunity for SPHCs. And so it's like, wow, what a what a welcome mat that is, you know. And really, two of the things in there, you know, really was around how expansion of telehealth technology can really help address the geographic barriers that, you know, are experienced in some rural communities. And I had mentioned that, you know, with the peer review article in West Virginia and also in Texas. And we have, our, you know, that in California too. And I think the second thing is related to that one slide that Amy talked about like the equipment and personnel and all the systems, right? And that is that telehealth services should be affiliated with a health system such as pediatric office, an academic institution, or a hospital that can provide standards and guidelines for use and expanded health services to students. And so I think that's really important to call out because, you know, as an emerging modality, an emerging field, you know, we do want to look at what are the standards, what are the guidelines, what are people doing, you know, around this, so that way we can learn from each other, but also it's not so willy-nilly. And I think especially because, you know, for school administrators, you know, they're really, for the most part, educators at heart, and healthcare might not be something that they're as familiar with. And so bringing in a set of standards and guidelines about how to roll this out, I think can really help ground a lot of the initiatives that are taking place. And so you know, I'm glad to see that this is part of the policy statement. But yeah, so we can share as a follow-up, we'll share the slide deck, but we're happy to put links to these policy statements that I think could be really helpful for all of us who are looking at expansion sites. We're really trying to make the case, you know, for bringing this to, you know, to some communities. Go ahead and go to the next slide. Okay, So I want to share a case study, and I just absolutely adore this health center that I'm going to talk about because I'm actually going there tomorrow. But we met them about over a year and a half ago, and really they've been really great partners in not only sharing what they are learning and doing, but really helping us, convene groups of people interested in school-based health center. And so our case study today, looking at school-based telehealth model, is at Sierra High School in San Bernardino. Next slide, please. Just want to give you context on what Sierra High School is. This school is part of the San Bernardino City Unified School District. It is an alternative school that serves primarily grades 10 to 12. It's a little under 500 people, but the staff there are amazing, as well as the school administrator, the principal, Mr. Marietta. And I have to say, when we think about school-based healthcare work, so much of this is, where is the administration on this? Because they really can help, either not make this happen or really make this happen and enhance the model and really bring care to their kids. And so for some of you, or for many of you who are looking at exploring partnership with schools, I mean, really, you got school principals. It's worth making that investment and bringing them on board. But you can see here for this high school, the city itself is their median income is lower than national. The majority or 70% are 12th graders. So you're looking at older high school kids. 67% males and 81% Hispanics. And so that just kind of gives you a sense of the student population that Sierra High School serves. Next slide, please. So their wellness center, which is sort of in the back of their campus, they basically converted, I think it's like 3 or 4 classrooms into this like modular building that is what they call the wellness center, which includes both academic counseling as well as mental health counseling. But also they called it a wellness center because they actually also provide oral health screenings and special, like certain dates, lots of health education, group counseling, but also for medical services, telehealth. And so these 2 photos here just, gives you a sense of what their counseling office looks like. Next slide, please. And then for mental health services, they actually have, I want to say, at least 4 or 5 of these rooms that, they did a beautiful job just making it really comfortable for students. And so mental health services are provided in person by therapists and other, I think, graduate interns. But, again, just to kind of give you a sense of their space. And then next slide, please. Okay, so this is kind of the meat of this profile. So what Sierra High School decided to do was really build out, like I mentioned, their mental health services. But when it comes to their medical services, they were actually part of a pilot program that San Bernardino City Unified School District did a few years ago when they partnered with Hazel Health to kind of look at, okay, if we partner with Hazel Health and roll this out at a number of schools, what does that look like? And Sierra High School was one of those sites, but I have to say they have continued on with this partnership. And so here you can see the little stand with the iPad and the rolling cart there. Those equipment were provided by Hazel Health, and it is what is used to connect students to the medical services with, through the with the healthcare provider on the other line. And they have the station in the backside of their wellness center, maybe not that far from where the mental health counseling is. And so when a student does present to the wellness center, either for an appointment for mental health services or what have you, or if they're not feeling well, they also come to the wellness center. If it happens to be where they do need medical attention, they do an intake, and then a small group of wellness center staff who have been trained to be, to basically facilitate this telehealth service will bring the students back, and there's a little bit of, you can see there's that wall there to at least give some confidence, privacy, but they will basically set, turn on the prompt and really get the student set up. And once the student is connected to, the Hazel Health on the other end, they sort of leave the student to then really engage in that visit. But yeah, it's interesting. And they've actually, when we were visiting a couple of times, they actually had a student scheduled and got her permission to actually have a few of us observe, which was a little bit weird, but whatever, just to kind of show us, what this interaction looks like. So next slide, please. And so I just want to go over, what their medical services include. IEHP is a health plan in the county, Inland Empire Health Plan. They actually have navigators who are there to help with, insurance enrollment and making appointments and what have you. And then the second bullet there, which is the Hazel Health period part, this is where they provide the telehealth on-demand healthcare on site, as well as weekly health screenings. And then I mentioned earlier, they also do, the oral health screening, and then a lot of community health education. I think if you go on to the next slide, I think it includes the flyer. Oh yeah, okay. Yeah, so this is the flyer that Sierra High School has up on their website, that Hazel Health, they worked with Hazel Health to put together, and looking at how families can connect, to Hazel Health at home, as well as how students can connect to Hazel Health at school. And you can see there just a wide range of, medical attention that students can get. Now, I have to say, and I know Amy can chime in on this, I think what we don't fully understand is how this really creates like a medical home for students, or perhaps it doesn't. Is this more of a acute care model? Because we know that in our school-based healthcare model, in addition to providing, the needed medical and mental health services, we also want to make sure that students are connected to medical home for that continuity of care. And so we're still trying to, figure out what all this looks like, but we wanted to at least profile Sierra High School as a site that is doing this. And I think, perhaps are still in that evaluative, mode to really understand how this is not only, what does this look like, not only in terms of utilization, but, is it really serving their students and their needs and keeping them at school, so that way they don't have to miss a day, because that's one of the objectives of having a school-based healthcare, in addition to actually getting students the healthcare services that they need. I don't know if you want to mention anything, Amy.
Yeah, if I could just jump in, I think one of the reasons that it seems like this particular structure is working so well at this particular high school is because they're bringing in Hazel Health to do a very specific narrow service, but they have all these other services being provided in person simultaneously, and they're making sure they all get linked. So the sexual and reproductive health services are happening, the behavioral health services are happening, the health education is happening, even dental screenings, right? All the other services part of that comprehensive healthcare are being woven together. Our concern would be if someone sort of picks up this narrow scope from Hazel, drops it into a school, and doesn't have the other pieces, because we know that Hazel, at least in this situation, isn't doing a comprehensive set of services, right? They're not doing the screenings for behavioral health. They're not making sure that students don't have unmet sexual and reproductive health needs, right? They're not linking to a medical home or doing ongoing chronic care management. So it seems like this narrow scope works because of the comprehensive services being provided in person. But if it was just this, then there would really be something lacking, because there wouldn't be all these other services. So that's sort of our caveat to this case study.
Yeah, and I want to mention that, for, like I mentioned, I worked in Los Angeles for a number of years. Many of the school-based health centers and wellness centers in LA Unified are actually operated by our FQ partners, federally qualified health centers. And I know many of them, pivoted, right, during COVID to really figure out the telehealth services. And so, that would look very different from what Sierra High School has. When you have a school-based health center on a school campus that is school-based, which is, sort of the big bucket that Sergio went over, but will then bring in a telehealth component to their offering of school-based healthcare, so that students can perhaps access this, in a different way, or maybe there is, a provider on site for 3 of the 5 days that the school-based health center is open, but maybe the other 2 days might be, delivering care through telehealth. And of course, like I mentioned, that's slightly different, not only in the structure and the systems, but also, with payer source and all the other fun things that I'm sure you all have been thinking about, when it comes to telehealth. Okay, I took up a lot of time. I'm gonna stop talking and turn it back to Sergio. Thank you.
Okay. So one of the things that, I want to also say is that really about reducing barriers, as we've discussed, right? So we want to make sure that the telehealth services that are in place are really age appropriate, affordable, culturally relevant, as it says here, cost effective and follow sound clinical guidelines. The importance and connection to having telehealth providers that are aware of the community, that can support with additional referrals or resources or in person, so that way they know how to navigate what's needed for the young person and their family and the community in which they're in. So just really wanted to lift that up as a key indicator of where we are. Right. You know, in addition, some other questions to think about if your you know, school site, your health partners working to, as a health partner, you're working with schools. Just again, as I mentioned, right, where are the providers coming from, right? Are they aware of the community resources? If they're able to facilitate ongoing care and referrals, what does that look like? You know, the needs of a patient will shift, and what's the ability of the provider to make connections with other resources or entities within their own specific health plan or program, or partnering agencies. Again, connecting the students back to their health home. We believe that's really important, something to consider. What about behavioral health? What does that look like, right? Okay, what about behavioral health? What does that look like? And then, you know, something that's important for adolescents, as we know, you know, many young people having medically accurate and, you know, judgment-free connection to resources to access sexual and reproductive health. If they have questions, if they've made their sexual debut yet, if they're thinking about it, what does that look like? And how can young people get connected to that care if it's something that they're looking for? Next slide. Excellent. I spoke earlier, and when I did the introduction of our work, I talked a little bit about being a member of the organization. And I think that, you know, membership, of course, brings a lot of benefits, as I've shared. And I think one of the most things that CSHA is most known for is our annual conference that we provide to the field, right? So really would like to invite you all to consider attending in our conference. This year's conference is, the theme is advocating for student healing and health. That will take place Monday, April 17th. With a day long of various workshops and speakers and connections for folks to share with one another and learn about our conference that we offer, with a variety of tracks of information for wherever you may be in your journey of offering school health services to young people. Whether that's we're dreaming about it and thinking about getting there, to we have a program, a room, a wellness center, to we have a, you know, school-based health center that we've been operating for 10 years, and we just want to learn, you know, newer best practices in the field or make connections with other folks. So it's a great conference. And then the 18th, on Tuesday the 18th, we'll be doing Advocacy Day, where we are supporting our stakeholders in the field to make visits with legislators to educate around the importance of school health resources on campuses. So definitely want to invite you all to attend our conference. It is on our website as well as in the chat, as it's been posted in the chat. So strongly encourage you and welcome you all to join our conference. And with that, if we can go to the next slide, just want to really say thank you to those of you who were able to participate and join our conversation. You will see contact information from myself and Amy, our Director of Programs, and Sang, who's our consultant extraordinaire. So if you have any other questions that you would like to follow up with us individually, I'm happy to do that. Or we're just also going to pause now and take a couple questions. I see the chat coming through, various questions. Yes.
Yeah, so I'm sorry. Can we go back like 2 slides? Because I want to mention something about one of the questions that's actually not on there, but I think we probably should be on there. And I think Amy can also speak to this, so I'm putting you on the spot a little bit, Amy. But one of the questions we get is like the costs, right? Like, you know, especially if you're a school administrator and you're looking at, oh, wow, I got approached by this company, or wow, I want to bring telehealth services to our schools because, you know, it just seems perhaps easier or a faster like build up than like a brick and mortar. And so that does come up, like, what is the cost, or what should we be paying? And, you know, I think, so I want to say, and I'll turn it over to Amy, but I know that for a school district like San Bernardino City Unified, they had piloted Here's a Health, you know, I think a couple years even before the start of the pandemic. And so I think they didn't actually share like their specific rate, but I know that it was really based on student enrollment, and it was either like a certain dollar amount per head or something like that. But I think the idea is that, you know, if the partnership is perhaps with and then the first bullet point are your providers local to the community. If it's a local federally qualified health center, it probably shouldn't cost anything or cost very much to the schools to bring telehealth services. And so, Amy, do you want to chime in? Because I know you and I've had many conversations about this.
Yeah, I think that's a great point. And actually, there was a chat question about this. How does the funding work? Indeed, we feel like anyone who's providing services in schools to students should be maximizing their billing and not charging schools, because schools do not have enough money to do, you know, the mission that they're here to do, which is to teach our students. And so we like to help school health providers and schools work together to sort of leverage the funding streams that are available for both. And folks can be billing. There is Medi-Cal, and for those of you outside of California, Medicaid that in California that comes through schools. And then there's lots of Medicaid that comes through health centers or mental health centers. And so we think that if people we have lots of tools and resources and forums and trainings to support this, but as long as people are sort of rating and maximizing all the funding streams available to them, the healthcare provider should not be charging the school or the school district to provide these services. So indeed, that should go on one of these questions.
And I want to say that I think perhaps we should have added another slide on questions for healthcare entities to explore with schools, right? Because it's a two-way street. You know, it's like, what should educators be thinking about when wanting to bring health companies onto, or just telehealth services in general, or broadly to their school campuses? But what if the other way around? And, you know, we talk a lot about, you know, partnership formation and what that looks like in cultivating these partnerships, you know, from both angles. And I think for, you know, healthcare entities who want to think about partnering with schools to bring, you know, their telehealth services to schools. The questions are very similar to what we would encourage healthcare entities to ask when we're looking at school-based healthcare model in general anyway. You know, everything from, you know, what does a space look like? You know, what is the support on campus? You know, what does the student population look like? What kinds of needs are, you know, does the school need and the students, you know, where, you know, what are the parents, you know, thoughts about, you know, providing medical services on campus, whether regardless of modality, those kinds of things. But also, you know, what was already mentioned earlier around, you know, the equipment needs and the technology needs and the system, and who is sort of there to help coordinate and facilitate all this, and what is the role of the school nurse in bringing this, right? Because we know for a number of years in our school-based healthcare, like broader conversations, you know, that was always sometimes school nurses felt a little bit, you know, like, oh, is my job at risk? And when in fact, it's actually, no, this is to help you with your job and to really enhance care for our students. And so really thinking about how you would bring telehealth services to school so that it really does align with the mission of the school and really just the education sector, because again, this is not their wheelhouse, right? Their wheelhouse is to educate students and help them matriculate, and you know, but you know, how do we do that in a way that is, you know, holistic, and that we really think about their wellness as part of what they need in order to, you know, have to be able to be in classroom and learn. So as we're talking, all of you, we're also learning, oh, what else should we be thinking about? And just wanted to share that. And so, okay, back to you, Sergio. I'll really be quiet now.
No. This is what we're here to do, right? Is to do our part to answer questions and things as they come up, right? It may be a webinar, but it's live. We're learning, right? We're exchanging information. Aislinn?
Sergio, this is Shiva, and I have a quick question. Great presentation, by the way. I learned a lot from you all, so thank you for the wonderful presentation. My question is regarding the broadband and the connectivity that's needed for the schools to be able to establish that telehealth program, right? So does that responsibility lie with the school, or is the partnering, FQHC or whoever, are they bringing in that infrastructure? Can you touch a little bit more on the initial setup for telehealth?
I can touch on that quickly just because I think it really varies. One of our colleagues likes to say, if you've seen one school-based health center, then you've seen one school-based health center, because they're so different. In general, facility infrastructure type needs are covered by the school district, but we do know some FQs that have built out whole beautiful spaces, including all that kind of technological infrastructure. So it really varies, and it's the most important thing really is just to get that clarity and that communication between the different partners about where's the money coming from, and can they work together to apply for grants or loans or whatever they need. But there's not sort of a standard way that it happens.
Okay, excellent. Yeah.
Also, I know that Sheila had 2 questions up in the beginning, so I want to make sure we don't lose those. She had asked about school nurses, and I can just take this quickly. Sheila, I don't know if you're in California, but in our state, there's a really deep shortage. School nurses are spread over multiple schools. So unfortunately, we don't have the school nursing that we wished we had, and the sort of level of services we wish we had, but absolutely having policies and protocols for referrals and assessment is part of the picture. It's about figuring out all the different partners on campus, whether they're physically in person or providing telehealth, and who can best meet them. And we have structures that we recommend. Cost teams is one of the structures of coordination of services teams, where specific needs of specific students are delegated to whatever the party on campus is that can best serve them. And then she had a second question. So did you want to take that one? If mental health services are provided and they also have outpatient mental health services?
Yeah, I think similar to what Amy just shared, right? I get it. Like, what I see in the question is, how do we account for ensure there's not duplication of services, right? So the thing there is, as Amy shared, it's very common for many schools to have a coordination of services team, a cost model, to be able to say, okay, what's happening with this student? Who is providing support to them? How are they connected? So I think that's one thing that we'll do, just to ensure that there's not duplication of services there.
And I think that's all the questions that have come so far in the chat. We are sending out the slides.
There was, I think, just the one quick question, kind of just about funding from Atsiri. How does funding work to support this partnership with Hazel? I know you guys kind of touched upon that. Services provided for free to students, but I think maybe is any insurance information collected from students and families? I think that was something that wasn't necessarily touched upon. Do you guys have any insight?
I can take that quickly. Yes. In fact, I believe that all the telehealth providers that I know of are collecting insurance information, which is why, again, we feel pretty strongly that they shouldn't also be charging the schools and the school districts, that everyone should sort of lean into and maximize their billing, but then not sort of look for money from either patients, families, or schools.
We are launching a quick poll to get some feedback. If you wouldn't mind, before you hop off, please respond. No. That was a lot of great information. For me, I learned a lot. Got to tell you, seeing the layout of the room was really helpful for me. It's great to see how they're using the space and set it up for telehealth, and a lot of great considerations to think about. Yeah, thank you guys for sharing. We want to let you all know on the next slide, new for CTRC, we have a school-based health center page added to our website. We're starting to collect some information and set up some resources for school-based health. So if you'd like to give it a look, we have some videos, some success stories, and some resources for school-based telehealth. And we're also, if you have suggestions for us for resources, we'd love that. We also have a new page focused on remote patient monitoring and telehealth that's worth checking out. And And then on the next slide, I'd love to share our event for next month. We'd love for you guys to join us for a remote patient monitoring learning event. It's going to be a whole half day of learning and peer sharing and networking about remote patient monitoring, and we're very excited. So we hope that you guys can participate as we focus on remote patient monitoring. That will be a great event. If there's any other questions, now is your time. And again, the presentation and recording will be made available by this week, and you will get an email to the email you used to register for this meeting. Oh, great. Thank you so much, Sergio, Amy, and saying that was so great. Thank you so much. It was a pleasure to have you. Great.
Thanks so much to everyone for their time. We appreciate spending the hour with you.
Right. And next.
And the recording.